Hey Gemma, so I want to preface this by saying, first, just be sure that you're aware of the precautions that the surgeon has set for you in terms of range of motion, how much you can move your elbow and how much weight you can lift and those sort of things. Outside of that, though, it's normal for your arm to have limited movement because, well, when you're in the cast like this for so long, the bicep muscle will, well, it's shortened in this position, it's lengthened in this position. So here it's short and it's going to adapt that way. So in other words, it's going to shorten and kind of stay that way until you actually stretch it out or elongate it. And that's going to take some work. The same thing is going to happen with the triceps too, because it's going to be kind of shortened in this position, whereas here it's elongated, right? So just the fact that you were in the cast for that period of time it's a long period of time. Both of those muscles will kind of shorten and adapt to that position, and it'll just be, take some work to get your full range of motion back. So the way that I like to have people do that is, well, for the biceps, we'll talk about that first, is just sort of prop your arm on, say, your sofa or a chair, the arm of a chair, anything would work. And just sort of let gravity kind of straighten your arm out, right? So you're just gonna sit here, something prop your, with your arm up for, 15, 20 minutes at a time, a couple times a day, right? Just kind of letting it hang out there, letting it stretch. It might even be painful there. So you'll have to build up to being able to tolerate that stretch for that long period of time. And then eventually, maybe you can use a small weight in your hand, 2 pounds or something. And then that will also kind of help lengthen that muscle. And so we can apply the same principle to the triceps muscle too. But in this case, you really just kind of need to apply some pressure with your other hand to bend your elbow, and that'll stretch this muscle. Now for the triceps, we need to do this in a couple of different positions. So one kind of down here with your elbow by your side. The other, we kind of need to take the arm up this way just because of the nature of those muscles. And so we need to kind of stretch that muscle in this position too. So it'll come, it's just going to take some time and some effort. But yeah, I hope that helps. And again, just make sure with your surgeon and therapist that those things are okay to do. All right, have a good one.